Ready for this video?
Sure.
Well, we've wanted to make this, I think, for a while, but Dana has autism.
Dana is autistic.
Well, how early would you say she started showing signs?
Well, she had the official diagnosis at 10 months. So we were seeing signs much earlier than that. I think we went in for her one of the wellness checks with Kaiser, and there was a few things that were missing there. They give you that long questionnaire of things, and she was missing some things in communicative areas. It was concerning, and they said, we'll check in at next step. I don't remember the exact time phrase. That might have been like the 6-month check-in.
Yeah, so some signs we noticed. She was obsessed with things that were spinning. So for example, Dan's grandmother, we had went to a restaurant and there was a ceiling fan, and Dana was just like watching the ceiling fan, not interacting at all. And you know, this was a young age, like 6-7 months, and normally by then you would at least have some eye contact, and she really didn't have any eye contact.
Still doing it. Again?
She would flick things with her fingers.
Kind of a strange gesture that I don't think I've seen other kids do. She's our first, so we didn't know what was normal or not, and we also weren't around a lot of other parents with little kids to do comparisons. So thought she just kind of had some strange quirks, but back of her mind, I think the thing that really did it was the way she was eating things was led Jenny to take her to an eating specialist, because she would just take stuff and not chew it and just instantly swallow. Just like, I don't know, it was strange.
We called it a hard swallow because she would literally make the sound like a cartoon, like and you know, this was even like so they start eating solids around 5 or 6 months, and then transition to like soft foods, and so berries and things like that, and she just wouldn't even chew them at all or attempt to chew. And I'm like Googling, like, well, are they supposed to chew because they don't have teeth? But you know, the what I would read said yes. And so we have really, really great insurance. We have Kaiser, we have an amazing plan, and we have an amazing pediatrician who's been amazingly supportive. And so
Jenny wants to be your friend.
any issues we have, we reach out to her, and she's always been helpful. And so I mentioned this, so she did a referral. It's technically, I think, a speech pathologist, but she was a feeding specialist. And so we went there, and this was at 9 months, and I'm pretty sure I have a video clip, so I'll insert it. Dana, hi. Oh. Try it again. There you go. There you go. Oops. Dana started walking really early, like 9-10 months. And so I have a video of her like kind of walking, running in the waiting room that day. And so Dana didn't really respond to her name. She struggled with eye contact. She never sat still and always on the move. And so the feeding specialist is actually, you know, who kind of broke it to us, like, hey, I think your daughter might have autism.
Well, she says, I'm seeing signs of autism.
Right.
And she said it matter-of-factly, but, you know, what kind of broke it to us, and it's like, how to say, I think you should look into it, or it's still pretty early, of course, because one of the things we saw as we went along, and as Jenny kind of shared it with some people, is that people are saying, you can't diagnose autism this young. You can't do that. You're labeling her early, and that you can't do it till they're 3 or they're much older. And we found out that's just not true. And catching it early is the best thing we could do for her. And that's what all of the different people that we talked to, because we got first diagnosis was for the school district, actually.
Well,
because
the first help.
The first help and
right.
actual like evaluation was from some of the school, child psychologists who did an evaluation. That was it. What? That was just like a month or 2 later.
Yeah, that was around 10 months, and so the feeding specialist told the pediatrician, who sent a referral to the school district for early interventions, and that was around 10 months. And so they did an assessment. We went there, and it's, gosh, we've been through a lot since then, right? She's 3 now, but all of these assessments take hours, and so we were there for a couple of hours. One thing...
And the waiting for the appointments take days and months, and yeah.
We feel really lucky, and they say because of her age and because we've started out early that they do try and expedite the process.
Because they want to catch it early. They're not afraid to diagnose or label somebody, if you want to call it that, early. And you can catch the sound of my tone of my voice is that there's some defensive things that we've come across where people seem to judge us or tell us from outside what we're doing wrong, raising our daughter and labeling her with autism. And I just want to say that they're wrong and they're dumb. So.
Well, people were like, you're overreacting, they never said like you're making it up, but kind of insinuating it felt like. And I am just, even in my own life in general, am proactive. So if there is something, what are the resources? What help is out there? And again, having such a great pediatrician, she just helps us really find those resources. And so as far as steps go, Kaiser can't officially diagnose until 18 months. But, again, all parties kind of knew this. So we started getting early interventions, and so we were approved for that. There was a special education teacher that came to our home and helped us work with her. And if anything, that was more parent training, in my opinion, because trying to teach her how to make eye contact with us, she really responded to tickles, or still does. So it would be, getting your tickle fingers up at your eyes and, do you want tickles? Dana, I'm going to tickle you. In that anticipation, she would be like, and finally make eye contact. And then the reward is the tickles. That's just one example. We found early on she was really interested and responsive to music, and still is, and books. If you look at pictures and videos of her as a kid, books are everywhere. I mean, and still, I mean, as she's gotten a little bit older, I kind of feel like she's read and memorized all the books, so maybe she's not as interested, but at such a young age to be able to look at those books. And then we also played a lot of YouTube music videos really early on. Super Simple Songs is a popular one.
I really recommend Super Simple Songs.
They're
great. They're a lot of the educational mixed with the nursery type rhymes, and they do a lot of. Some they're just literally, let's just count to 20 musically, and she can count to 30. She can count higher now. She could probably count to 100. If we just let her, and she could sit still long enough to do it. But
she was always on the move. And again, a lot of these she still is, but I'm just going to refer back to when she was younger. These are some of the things that we saw. So always bouncing off the walls. And at that first evaluation at the school district, I remember she bumped into like this mirror or something, pretty hard and just didn't even react and kept going. And their concern was that she didn't feel pain, which can be something that autistic kids can struggle with. And she has a high pain tolerance, we know that, but she does ultimately feel pain, which is a good thing. And so Dan and I would, when she would be sitting on the floor, you know, we would actually take pictures and send to each other. But even as a, you know, tiny kid walking, she would be like drinking her bottle as she's walking.
Hello? Do you want to play?
You know, climbing. So
Yeah.
I have notes. Let me look and see if we missed anything. Oh, she did do something. She still does it a little bit now. So autistic kids do something called stimming, which is, I don't know if it's like a comfort thing or when they're really excited. So, you know, even neurotypical folks, which would be, you know, someone that doesn't have autism, you know, what people might say a normal kid. Neurotypical is the right way to say it. You know, you get excited, you jump up and down. You're like, yay, right? Well, they do it, but times 10. So she did this thing called happy hands where she would like squeeze and like this, like, you know. To you, happy birthday, dear Dana. Happy birthday to you. Some kids do a flapping motion. She didn't really do much of the flapping, but definitely the happy hands. And it kind of looks like she's like frozen a little bit.
She's getting electrocuted.
Yeah.
She's happy electrocuted.
It's happy. And let's see. She always needs to know her perimeter. So that's something the special education teacher pointed out to us, was she just has to know, you know, with this running thing. And small spaces are fine too. I think she likes small spaces, but it's kind of hard to get a small space. Excuse me. Let's see. Easily distracted. You know, hard to get her attention sometimes. She didn't respond to her name at all. Now she does, but sometimes you have to say it a couple of times. And it's not that she's trying to ignore you. It's that she's just thinking a mile a minute and, you know, bringing her back.
Started doing the parent full name thing, kind of just to get her attention. Dana, Eric. And it kind of works.
She, sometimes I'll say, look at my eyes, and it'll take her, you know, a little bit, and then she will, and that kind of brings her back a little bit too. That's just recent. No pretend play. That was a big one that was part of the diagnosis. So Kaiser can't officially diagnose till 18 months, and we all knew this, and so, you know, as soon as she had her 18-month visit, that referral went in, and they got her in within a month or two.
Which is great, because most people were talking about, oh, you're going to wait a year before you get in there. But no, if you have these steps set up before early on, it's more of a priority to get in early intervention. The earliest you can get in there, the better. You can start services, you can start behavioral therapy earlier to counteract the negative issues with ASD. And, you know, hopefully so by the time they get to school age, that they can go to normal school and participate in normal social cues and things at that point. Yes, that's the whole point of the therapies that we give her, and all these, you know, schooling, all these diagnoses, was to get her support so that she can lead a more normal life.
Yeah, and be more independent. That's something that they mentioned to us, you know, if you have a curve of, you know, here's a neurotypical child and here's Dana. You know, you want someone told me by age 5, you know, you really want it more like this. Again, it was like a couple of hours of assessment, but that was one thing that the doctor, it was done by a psychiatrist, a psychologist, had a bathtub and a baby, and, you know, so she's like, okay, Dana, so how do we play with the bathtub and the baby? And then Dana, like, you know, bangs them together. Well, you know, by 18 months, which is, you know, Delta's 18 months, easily we can see, so Delta is neurotypical, and we can see a clear difference in that. The intention with a neurotypical child might be to put the baby in the bathtub, to take the little pretend sprayer and spray the baby, take a sponge and bathe the baby. You know, Dana didn't do any of those things. I mean, just no pretend play at all. So she has
Dana would take all of the babies and organize them into a stack of babies. That's
like with like.
Like with like. She would organize some things. She didn't do a lot of, I guess, one of the more common ASD behaviors is lining everything up. Well, I've seen her do that once or twice. But she does sort things occasionally. And put all things in kind of same spots. She did that with a bunch of little people. Sort animals,
all the animals and the people.
And kind of separate them out a little bit. But.
Right. So, as soon as she got the diagnosis with Kaiser, we started ABA therapy, which is called
Applied
behavioral. Sorry, I always want to say analytical. Applied behavioral analysis.
There are a lot of acronyms. There really are.
Still
Some
is.
of them are just like, sometimes I can tell they just make up acronyms and they make up their own words to describe something that you could use normal words for. That's the whole. Sorry, that's my side rant about psychology and child psychology and social services, and because, you know, they like
manding.
Manding, and that's a word making up. I don't even remember what it really means.
That you're I guess it's like demanding something. You're telling them to do an action.
Why don't you just say demanding?
or doing something. I don't know.
Make it sound smarter if you come up with your own whatever. Side rant. And our daughter is autistic. It's not something that she can grow out of. She can learn to deal with. Her brain is not wired the same way as everybody else's, and that's what's going to happen the rest of her life. Yeah. And that's the important thing, you know. It's not that she has autism. She does, but I've heard adult autistic persons describe this. It's like they don't want it to seem like it's something that they have. It's a part of them.
Yeah. And it's so hard to know. I mean, that's where I've watched videos, and we watched videos on, you know, adults and how they want to be addressed and how they want to be perceived and understood. And we're still learning. You know, we don't have all the answers. That's something I wish from the beginning there was more parent support, because even though we knew, it's still hard. It's hard all the time.
Like I said, we didn't have a lot of support around us. We moved up to this area for my job, so all our family, you know, almost all our families down 100 miles away, friends that have kids and stuff too. We might have noticed things a lot earlier on, and, you know, we're kind of doing this on our own.
Yeah.
And, you know, thank God that my job at least gives us really excellent health care through Kaiser that pays for all these things, so we could get this ABA therapy, and they pay for it. Otherwise, I mean, I don't know.
We got the diagnosis from Kaiser and started ABA therapy about a month later. I mean, maybe 6 weeks, but it was pretty quick. And I don't even remember how many hours we started out as, maybe 20 hours a week.
I think they booked us we could have done 40.
Yeah, we were approved for 40, but I wasn't sure how that would work. And she started in daycare, so we had her in a kinder care, which is like a franchise daycare, in October. I don't know if she was officially, I don't know. it's all a blur. We probably have it written down somewhere, but
You could track out the timeline somewhere, but yeah.
Yeah,
No, I
and
remember when we were going there, we were discussing with them that she might have somebody come to, well, I think that was early intervention services, could come
Right.
to the school and hang out with her.
right.
Somebody might do that, you know.
So when she started ABA therapy, at this age, it's play based. So they're literally just sitting and playing with toys, and especially early on, she is really drawn to books and music. So always, musical. We probably already said that, but so something that she has that is unique is she could count really early, and she knew her full alphabet. I used to joke around like, yeah, I'm starting to teach it backwards now. She knew all of her shapes and colors.
Dana, what are those shapes?
Circle. Triangle. Shell. Triangle. Oval. Side.
Good.
And this was over a year ago, and she's 3 now. So now she is starting to read, which I know sounds crazy, and we thought it was crazy.
I'm not saying like cat, dog, like randomly, so we can point out random words that, hey, what's that? Giraffe. She just read giraffe. She cite words. Perhaps when I say reading, she doesn't like comprehend everything. She doesn't read books and understand everything, but she can read through complex words that are way beyond her level.
I mean, summer, surprise. These are words. Now, is she sounding them out? Probably not. But she is definitely a memorizer for sure. She also does a thing where she is repeating you. That's a huge thing, especially right now.
Parrots a lot of stuff.
So,
Sometimes it's her way of saying yes to a
like
question.
acknowledging.
Is by just repeating the question back kind of in a higher tone.
Yeah. So if you say, Dana, are you all done? She'll say, all done. And then, no, yes or no. And then she'll say, yes. Or she'll say, no. That's been one that ABA has definitely assisted with is to speak. She
didn't even say no until a few months ago, if you really think about it. I want to say it was this year, right?
Yeah.
She started saying no, or the first time she said, I need help, was the beginning of this year.
Yeah.
And that's something that ABA did for her.
ABA, in our opinion, has been wonderful. I mean, she has learned so much, way more than we could have taught her. I've talked to a few parents that I think put a lot of pressure on themselves to, teach their kids, especially their ASD kids, how to function and learn these things. And I have always said, I'm not the expert. These folks, this is their job, this is their career, this is what they're trained to do, and they have years of experience doing it. We are still pretty new parents, and it started out with the special education teacher that would come to our house. She taught us so much that